My doctor says I might have a thoracic aortic aneurysm or dissection. What does that mean?
The aorta is the main blood vessel that carries blood from the heart to the body. The part of the aorta in the chest is called the thoracic aorta. A thoracic aortic aneurysm means the aorta in the chest is enlarged. A thoracic aortic dissection means the inner layer of the aorta has separated from the outer layers. Blood then flows between the layers of the aorta instead of flowing through one channel. An aortic dissection can cause the aorta to burst, which is a life-threatening emergency.
Do I need an imaging test?
If you have a thoracic aortic aneurysm or dissection and have not yet been treated, your doctor may recommend imaging tests such as CT angiography, also known as CTA or CT scan of the arteries, of the chest, abdomen, and pelvis with contrast, CTA of the chest with contrast, MR angiography, also known as MRA or MRI of the arteries, of the chest, abdomen, and pelvis. An MRA can be done with or without contrast. These tests show blood flow through the aorta and its branches.
Will I need imaging tests to prepare for the procedure?
If you are preparing for open aortic surgery or aortic stent placement, your doctor may recommend CTA of the chest, abdomen, and pelvis with contrast, MRA of the chest, abdomen, and pelvis with contrast. These tests help doctors plan for safe procedures.
What imaging can I expect after the procedure?
After aortic surgery or stent placement, your doctor may recommend repeat imaging to watch the aorta. This may include CTA of the chest, abdomen, and pelvis with contrast, CTA of the chest with contrast, MRA of the chest, abdomen, and pelvis with contrast. Imaging tests are important to detect thoracic aortic aneurysm or dissection, plan procedures, and check the aorta after treatment. Talk with your doctor to decide which test is best for you.